course, it is the second day of the nurses' strike. Nurses are remaining adamant that they'll only call off the strike if the demands are implemented by the county governments. 18 county governments were nurses on strike. 11 county governments have so far implemented the return to work formula that was signed in 2017. Now, let's cross over live to Murang'a County and talk to a reporter, Stanley Beach, who's keeping tabs with the developing story right there. And Stanley, good morning. What is the latest development from Murang'a County? Has the county government tried to engage nurses? Because the nurses union officials were saying that they want the county governments to be the ones talking to the nurses and not the conciliation committee that was formed by Labour Cabinet Secretary Ukuri-Yatani.
Well, thank you very much and good morning to you, Radido. The basis of your question today, should nurses return or down their tools, is what formed our presence here at Level 5 Hospital in Murang'a County at Murang'a Town. And Radido, the nurses here in Murang'a continue to perform their tasks, but they've given the county government an ultimatum until the 18th of this month. Should they not honor the return to work formula, they will down their tools. It is the basis of this that we had to come here and clarify if indeed services continue to be offered. And we have spoken to several patients walking in and out. I happened to stumble upon one lady who was carrying a young child, and she had come for BCG. She came here yesterday, but she has been told to come back. That is the situation as it is, but at least from the nurses' perspective, from the CEC, Minister of Health, Joseph Mbai, here in Murang'a, he has assured us that they have had an ultimatum agreement with the nurses that until the 18th is when they have a period, a grace period, to ensure that the return to work formula has been met. Here we remember that as at yesterday, 11 counties have joined the strike, and Murang'a County has not yet. It's one of the counties. What is the ripple effect of this strike here in Murang'a is that should the nurses go on strike come the 18th, and the lack of enough BCG across the whole country, together with the antiviral medication for HIV patients, then it should bring a worrisome situation. But further to clarify and give us an insight of how situation and things are inside here, joining me here is Reverend Cairo. Thank you very much, sir, for joining us. I saw you coming from inside the hospital, and you were coming out. You gave me an insight in regards to how services are. If you could kindly come forward, how are the situation services inside the hospital itself?
We have been here since yesterday, and we brought our sister who was in an emergency from Kirogo Health Center. And nurses and doctors are here. They received us very well, and they gave us the services well, and they admitted our sister, and she's doing it very well. She's recovering very well, and we are so happy for the services that we are receiving from the hospital.
A great concern with the Kenyans is that should the nurses down their tools, what effect do you think is going to come out, given there is not enough BCG across the country? And HIV patients are also asking for the government to ensure that there is surplus HIV medication to sustain them to be able to live well just like every other person. What is the effect of nurses downing their tools? Should it happen on the 18th here in Murang'a?
To me, they should not put down their tools, because the mwananchi wa kawaida will cry the more, and the services won't be received. But the government should put their remedy and their actions to practice as they work hand in hand with the doctors and nurses to straight that everything is running. The BCG is running, and know the medications that is needed, the medicines that is needed, and even the personnel which are needed to be in place, they should play their role well.
The county council of governors through Ukuri-Yatani has put a mediator between the county governments together with the national government to mediate and negotiate over this issue. The three of them, including one from Labour, Kotu, are supposed to ensure that as a deal is struck between the two parties. Why do you think these are stalled so long for government to ensure that nurses are well paid and that their return to work formula has been honored? Because we should look at the two sides of the coin. The nurses need their side of the story addressed, as the public also wants services to be rendered. Two functions now colliding at the same time. What is your thought on this matter?
That's why I'm saying that all of them should come on the board and discuss the matter and come up with a conclusion, and the agreement that they will have should be met by either party, so that we can have a smooth running of medical attention, because that's the heart of the society.
What is your expected outcome of this whole thing nationally?
Me, I'm praying for them that they come to consensus, so that they may not put down their tools, so that we may have smooth running of our society.
Thank you very much. That is one patient, or rather one of the patients, or someone who came with a patient here at level 5 hospital so as to get services for his sister, giving us an insight of exactly what is going on here in Murang'a County. As I told you earlier, services here have not stalled, but they've given an ultimatum until the 18th of this month. Should they not honor the return to work formula, then the nurses here in Murang'a will down their tools, or rather will keep tabs and also keep an eye watch on the development of this issue from here in Murang'a. As we know, the rollout plan by the national government of a pilot project in the counties of Kisumu and here our neighboring Nyeri County could affect the pilot project should this strike continue to hold its waters. Back to you in studio, Radido.
All right, thank you so much, Stanley Bichu. We'll wait and see when, after the 12 days elapses, whether these nurses from Murang'a County will down their tools. So far, we know that they're working until the 18th of February to see whether the county government will heed to their call. Now, to the coastal region, where a coast-based human rights body, that is Haki Africa, now wants all illegal buildings in Mombasa to be brought down, just as it happened in Nairobi. Our Coast Affairs reporter Tobias Chanji now joins us live from Mombasa with the details. Chanji, good morning. How many buildings are we talking about in the coastal region?
A very good morning, Brenda. Somewhere late last year, the human rights body Haki Africa gave a list of around over 2,000 buildings that it said were either built on riparian land or access roads, with also some being said that were built on land that was acquired illegally. Over the same, the Haki Africa has already written to the county government of Mombasa and also the National Land Commissioner about the fate of those 2,000 buildings. We are now joined by Haki Africa Director Khalid Hussein to maybe just update us so far where they've reached with those illegal buildings. Welcome to our studio. Just give us an update of where you are at the moment.
As you've rightfully said, we've already communicated to the county government. At the same time, we've also sent a complaint letter to the National Land Commission so that they can follow up to ensure that these buildings that have been built on riparian land, we have buildings that have been put up on access roads and also on public land, for example, Mamangina Drive. We've told them that according to the law, these buildings are required to be brought down. So we've been following up with them. They said that they've commissioned their own investigations and that very soon a report is supposed to be tabled at the cabinet level of the county government. And once that report is confirmed and approved, then we will begin seeing the demolishing of these major buildings.
How did you come up with that number? Because it's not a small number.
Yes, what we've actually done, we followed up through the National Land Commission, and we were able to confirm that there are actually some of the streets that are completely taken away. We've also followed up with the county government itself, and they were able to confirm from their building plans that actually these numbers are true. So we've tried to communicate, we've done an estimate. The 2,000 buildings we're saying is in the minimum 2,000 buildings, but they're not just buildings. They are residential houses, there are hotels, some of them have even encroached on public beach. So we did a count and we confirmed that they are in the minimum 2,000 buildings.
Some of the buildings were constructed even as early as 1920s, meaning they have an historical impact. So how are you going to make sure that such buildings are also going to be brought down?
I think it's very true that some of these structures have been there for many years, but we have to be cautious when dealing with these issues because we know that Mombasa is a historical city. That is why we said, first of all, we want to share this information with the county government. They're going to do their own assessment. For example, we know that the sea levels have been rising, and the distance between the sea and the buildings has also been affected by the rising levels of the seawater. So all these issues are supposed to be investigated, and we believe that there are some that are clearly on access roads, on riparian land, and these are the ones that need to be brought down immediately.
Without mentioning the names of such buildings, will you kindly just brief us the areas that these buildings are?
Tobias, these buildings are actually across the county. We have buildings that are within the beach line in Shanzu area. We also have buildings that are in Nyali, major hotels, structures and things like that. When you come to town, we have areas such as Ganjoni. We have areas including Chuda, where complete roads have been taken away. We have places like Mamangina Drive. I think recently you also had the president and the governor talking about this. We have buildings that are now schools. Some of them are hospitals. Some of them are, residential houses. And all these buildings are on land that belongs to the public.
So do we have any other institutions in those lands? Because the trend has been here, the course that when people grab land, the first thing they'll construct is either a mosque, a church, or a school, or another institution.
It is true. Most of these people hide behind these social structures, for example, schools, churches, and so on. We know, for example, of property that is right in the middle of town, near Makadara area, where the community grabbed this land and they've constructed a mosque in that area. That's why we're saying these issues have to be investigated deeply. The county government has to do more to investigate, to ensure that any public land that has been grabbed for purposes other than the use of the public is taken back and the building demolished.
What of documentation? Because some of the owners say they have proper documentation.
Yes, this is something that we seriously need to look into. All the structures, majority of the buildings, particularly within town centers, if any construction is ongoing, then the county and the land office usually authorizes. So one of the things we want to investigate critically is who are these people who authorized the construction of these buildings. We cannot allow these people to walk scot-free because they are the people behind these atrocities that have been committed against the public. So we want to make sure that any officer who was involved in one way or another to help an individual to grab public land, that officer must be made to account for the mistakes that he made.
Are you maybe going to give a timeline of when you want to see this happen?
We've informed the county government that we expect to see action within the first quarter of this year. We gave them our report, we gave them our information in the last quarter of last year. They told us that they're investigating, they're commissioning their own study to confirm the veracity of our report. We agreed to that. We are expecting that their report will be filed in cabinet this month. And after this month, then we expect them to begin the process of demolishing. So we are giving it up to the end of March, a failure to which we will then take on the county government for failing to take back public land.
Thank you so much, Hussein. Well, Brenda, that was Khalid Hussein, who's the director of Haki Africa, a human rights body here in Mombasa, just talking about giving us an update of the buildings that they condemned to be constructed illegally here in Mombasa. People are anxiously waiting for the action to be taken before that March, the timeline that is already given. Back to you in studio.